Okay, hi, I'm Oybek Rustamov, a fertility specialist. I work in Brisbane Adora Fertility. So this is a quick introduction to IVF series, live stream videos I'm planning to present. So this video is mainly tailored for my own patients, but I made this available to public in case you find it useful. So essentially, my plan is to cover each and every step of IVF by doing short 5-minute live streams like today, then do one long 1 hour live stream for each of the 7 stages. So essentially, I have to do 55-minute live streams and 7 60-minute live streams during next couple of months. So today I will cover IVF cycle. That whole presentation will take probably only 3 to 4 minutes. So we will cover it as introduction. So IVF cycle consists of 7 stages. So first stage is baseline workup. Second stage, ovarian stimulation. Third stage is egg collection. Fourth stage is fertilization of eggs. Next stage is embryo development, then embryo transfer and luteal phase support. So then we will go into each of the stages and discuss each of the steps within the stages. So let us say when we discuss baseline workup, which is the first stage of IVF, which I think is most important, most crucial stage of IVF. So here we will discuss investigation for female infertility. We will discuss the role of age, health, reproductive health, ovarian reserve, for example. Then we will discuss role of male general health and reproductive health, and we will explain what tests need to be done before we can start IVF treatment. Then we will discuss how we plan the cycle, how we will create individualized protocol for each patient before we commence IVF cycle. So then we will move to the next stage, which starts from the first day of menstrual period. So during discussion of this ovarian stimulation stage, which lasts approximately 10-12 days, we will discuss the role of gonadotropin injections, different types of gonadotropin injections. Then we'll discuss the role of antagonist injections and the cycle monitoring, how we monitor the cycle using ultrasound scans and blood tests. And then we will discuss the role of each of these investigations. Then we will discuss the trigger injection, the different types of trigger injection, the role of trigger injection. Then we will move on to egg collection. So we will cover the techniques of egg collection. So as a patient, what you can expect before, during, and after egg collection. So we'll discuss and review the assessment of quality and quantity of eggs, then assessment of quality and quantity of sperm, and then we will review next stage of IVF, which is fertilization of eggs. And here we will discuss the 2 different types of fertilization methods using ICSI and IVF, the difference of these methods, why we choose IVF in some patients and why we choose ICSI in other patients. Then we will discuss, we'll have a detailed review of what is considered as a good fertilization, what's considered as a poor fertilization. Then we will move on to the next stage, which is embryo development, which lasts approximately 3-4 days. So, and here we will discuss what's involved in incubation of embryos. So then we will review the assessment of quality of embryos. So how we actually grade the embryos in top grade, borderline, and poor grade embryos. So so then we will move on to next stage actually, which is embryo transfer. So we'll discuss the techniques for embryo transfer, and as a patient, what you can expect during the procedure and after the procedure. So then we will cover the last stage of IVF, which is luteal support, which starts a few days before the embryo transfer using progesterone. And then we will review what you can expect in luteal phase of IVF. So we will review when you do pregnancy test and when you will have a 7-week scan once we achieve pregnancy. So overall, in the series we can see there are 7 steps, the number of stages, number of small steps. So altogether, we will need to cover all stages and steps to give you full information about IVF treatment cycle. Okay, so the live streams will be streamed to all these social media channels. I'm using this Fertility Now How, which is my educational channel. Please join the socials, and so that you can stay up to date. So, as for professionals like fertility nurses and embryologists and specialists, I would be grateful if you could contribute to that, and just send me send me text on my comments. So if you'd like to contribute on this project, thank you. Thanks for your time. Enjoy the evening. So I will see you next time. Thank you.